Okay, I will speak as loudly as I can, and hopefully my voice will hold out for an hour. I'm a volunteer with Senior Medicare Patrol. In today's talk, I'll explain to you what Senior Medicare Patrol is, the history of it, how it got started. We'll talk about the differences between fraud, errors, and abuse. And finally, what I consider the heart of this presentation is how to protect, detect, and report healthcare errors, specifically around Medicare. Then we'll talk about using a personal healthcare journal, which I think some of you picked up on the front table. And if you want one and we ran out, I'll take your name and we'll get some more copies sent here. And then there's some additional resources that I'll tell you about. So back in the 1990s, the people at the Centers for Medicare and Medicaid realized that there was fraud going on with Medicare. Basically, that Medicare was paying for things that didn't happen or shouldn't have happened. And someone came up with the idea of developing a peer-to-peer program where people like me, who were Medicare beneficiaries, go out and talk to groups of other Medicare beneficiaries, like all of you, to try and help people to identify when these problems were occurring so that some action could be taken. So that was in the 1990s. They tried it out in all the states that have very large Medicare populations, California, New York, Florida, I think maybe Pennsylvania. And it turned out that the beneficiaries who were being educated through these peer-to-peer sessions actually were identifying some of the problems with Medicare. So then the program was set up in all 50 states and, Guam, Puerto Rico, et cetera, everybody that's part of the United States and has Medicare. So the program is funded by grants to each of the states. And in Massachusetts, there are 3 full-time people that run the Senior Medicare Patrol program. And most of the work, I would say, gets done by people like me who go out and do these talks and go to healthcare fairs. And then there are people who help with case management. If you have a problem, you can call Senior Medicare Patrol and they will help you get it resolved. So the mission of the nationwide program is, as it says on the slide, to empower and assist Medicare beneficiaries, their family members, and caregivers to prevent, detect, and report healthcare errors, fraud, and abuse. We do it through outreach, education, and individual counseling with people who have problems. In Massachusetts, we take the mission one step further. We try to reach, educate, and activate Medicare and Medicaid beneficiaries and everyone who is associated with them on the importance of being an engaged healthcare consumer. And I'll talk a little bit more about what that means. So let's jump right into this. What is fraud? Fraud is when someone has the intent and the knowledge and they lie in order to be reimbursed for services that were not provided or rendered. Pretty straightforward. The magnitude of the problem is conservatively estimated at about $60 billion a year. That's billion with a B. When you consider that the total Medicare budget is about $850 billion now, that's about 7% of the total Medicare budget. I think that's pretty substantial. And the $60 billion is a conservative estimate. I've seen estimates as high as $90 billion. So this is the problem that we're dealing with. And I think all of us would rather have that money spent on our medical needs than lining somebody's pocket who was doing something fraudulent. Okay, then there's errors. I'm sure every one of you has experienced some kind of a billing error with something. Sometimes the billing people in the doctor's office make a mistake. They put the wrong code down, and it turns out it's something that Medicare won't pay for. That's an error. That's an easy one to fix. There are abuses of the Medicare system, and some of the abuses are things like asking for medical tests that aren't required, and in extreme cases, doing medical procedures that are not medically indicated. So we have these three categories of things that can happen: errors, abuse, and fraud. The bottom line is that they all result in the same thing: money being paid for something that didn't happen or shouldn't have happened. Or in the case of an error, maybe it's something that should have been paid for but wasn't. So let me give you some ideas of some fraud schemes. Sometimes something will be billed for a service that was not provided. A friend of mine went to the orthopedist. She had a knee problem, and they prescribed PT. Well, she gets that Medicare summary notice, and it says that she got a cortisone shot. Well, there are certain things like cortisone shots that Medicare will only approve so many times a year or every so many months. And she knew that if she didn't get that error fixed, that if she did need a cortisone shot in a couple of weeks, she wasn't going to be able to get it. So she called the doctor's office and said, "I want you to fix this." And they said, "Oh, we can't change your medical record." Well, she happened to be a physician, and she said, "I know that you can change my medical record, and I want you to change it." And she got it fixed. So sometimes when you're billed for something that wasn't provided, it's important to get it fixed because you may need that service in the future and you won't be able to get it. There are scams with home health care where the home health care agencies have billed for services that weren't actually performed. There have been situations where x-rays were prescribed for the wrong body part or an MRI for the wrong body part. There have been cases of drugs being diverted to the wrong patient or an incorrect medication or the wrong amounts. You know, you go to CVS and they don't give you the right number of pills. There's something called upcoding. Now, when you go to the doctor, there's like 5 levels of visits: 1, 2, 3, 4, 5. And sometimes the doctor's office bills for a higher level of visit than you actually had. So that's what upcoding is. Now, unbundling is when, say, you need to have all these cholesterol-related blood tests done, and it's done as usually as it's written as an order for one test, and it's cheaper. Medicare gets billed less than if each individual blood test were prescribed separately. And sometimes they'll separate it, it's called unbundling, to get more money. There's plain old identity theft, which I'll talk a little bit more about. And there are false providers. There's one big scam that has gone on. It has to do with durable medical equipment. I don't know if any of you got any of these phone calls where people call you up and they say, "You have any pain?" Let's be honest, right? At our age, everybody's got some kind of pain. So the person says yes. And they say, "Well, we have a brace for you. It'll solve all your problems." And the person says, "Okay." And lo and behold, all of a sudden, all these braces start showing up at your house. We had one case at Senior Medicare Patrol where the woman was sent $20,000 worth of braces through one of these scams. So, and that's another case where if, say you got sent a knee brace and then you hurt your knee in a couple of months and Medicare says, we can't pay for that. You already got one. So that's another thing. And then the way they do this is through what we call false front providers. They create a sort of a scam company, and they'll get it could be a nurse practitioner, or in some cases it's been like a medical resident. They get them to stay on the phone while the scammer is talking to you and getting your Medicare number, and they certify that you need this brace. So I don't know, have any of you experienced any of that, getting any of those phone calls? Okay. And as I mentioned, durable medical equipment is another place that's ripe for this kind of stuff. If it's a Medicare Advantage plan, that is exactly what they're doing, because they get paid based on the medical status of their insureds.
The questions are so general that it's almost like, yes, I've been twisting your ankles. You know, I mean, the questions are just so general that you just feel that they're cooking something up to make it worse than what it is.
They probably are. But, you know, I don't want to get into Medicare Advantage, but that's what they're known to do. So, okay. So let me give you some examples. So you think, well, this stuff doesn't happen around here. But this was from, is this the one from, here it is. This was from February. And there was a person who happens to live in Sharon who allegedly billed Medicare for equipment patients did not need. And he was charged with a fraud scheme that garnered nearly $30 million through the billing of Medicare for unnecessary durable medical equipment. So you think not around here? Yes, it happens around here. Here's another one. This was also from January. This is not from around here. But he was sentenced to 10 years in prison in order to pay more than $26.6 million in restitution. He was convicted for causing the submission of over $70 million in fraudulent claims to Medicare for medically unnecessary orthotic braces and genetic tests ordered through a telemarketing scheme. So there's a lot of evil people out there. Yeah. So, and you say, well, you know, how does this kind of stuff happen? Well, let me give you a case. Now, this is old. This is not recent, but I think it illustrates how people get away with this nonsense. So in California, there was a doctor who charged Medicare for more than 6,000 services totaling over $500,000. Now, hold on to your seat. For 42 patients. Do the math. That's more than $10,000 a patient, all right? He was billed for 2.5 hours of FaceTime with patients. That's a level 5 visit. I don't know who would bill for that kind of time. The guy's not a psychiatrist. So he was paid for 2.5 hours of FaceTime with patients for visits and claimed he saw each of his 42 Medicare patients an average of 35 times a year. Who goes to the doctor 35 times a year? Maybe even a psychiatrist, maybe you would go 35 times. So you say, well, you know, how does this happen? Well, it happens because people don't pay attention to those Medicare summary notices and go over them to make sure that there isn't something on there that didn't happen to them. Or if they do go over it, they say, you know what? MedX is going to pay, my Medigap policy is going to pay the other 20%. I'm not going to worry about it. Well, the bottom line is you should worry about it because you pay for your insurance. We all paid for Medicare all those years that we worked, and it is coming out of your pocket. So that's one of my messages for today. So we talked already about durable medical equipment. Let me give you another story. I think I have a lot of stories, and I think that through the stories, you get the idea of what's going on. A friend of mine's mother broke her hip, and she was in rehab. So my friend goes to the rehab place to do the discharge planning for her mother, and her mother's walking up and down with a walker in the rehab place. And the person handling the discharge, I don't know if it was a social worker or exactly what the person's position was, she says to my friend, we can get your mother an electric wheelchair. And she says, what does my mother need this for? Here she's doing fine going back and forth in the hall with the walker. And this person from the rehab says, well, Medicare will pay for it. That's an abuse, okay? Another example of a durable medical equipment. One of the most famous cases that Senior Medicare Patrol handled, and this was more than 10 years ago, there was a woman who had an electric wheelchair, and she needed a new battery for it. And somebody in the housing complex where she lived saw this glossy ad that Medicare will pay for a $4,000 motorized wheelchair, and she got conned into ordering this. Well, apparently, when you get a wheelchair of this type, it has to be like fitted to you. It's almost like getting orthopedic shoes or something. So they deliver this wheelchair to her apartment, and it's too big. And she's banging into walls with it. I think she did something to one of her toes. Anyway, somebody told her to contact Senior Medicare Patrol, which she did, and it took several months, but Senior Medicare Patrol did get the problem resolved. The company had to take back the wheelchair, and she got the proper wheelchair. So, all right, before I go on, I just want to talk a little bit about the basics of Medicare, and bear with me if you understand all this stuff, the ABCDs of Medicare. How many of you are on basic Medicare? That's where you have the card with the blue and the red stripe on it, and that's what you show when you go to the doctor. Okay, so the rest of you then are on some kind of a Medicare Advantage plan like Tufts or where you pay a copay when you go? Okay, because there are a couple of things that I'm going to talk about that are a little different if you're on Medicare Advantage, and I'll try and highlight that. Okay, so for those of us, for the people who are on Medicare Advantage, that's called Part C. I don't know why C, but that's what it is. Probably because it came before the drug plans, which are now D. So Medicare Part A basically covers the hospital. It will also cover hospice in total if you need hospice care. And then Part B is the part that covers the doctor's visits, if you go to PT, anything like that. And then there's Part D, which is separate, which is for drugs. Okay, so we're all on the same page about that. All right, good. All right, so this just reiterates what I said. And then if you're on basic Medicare, you have some kind of a Medigap plan that covers the 20% on Part B. Okay? Everybody's with me. Good, good. All right, now, this is the part I want you to really listen closely to. I'm going to talk about how do you protect your health care information. Whoops. How do you detect if something is wrong? In other words, if there's something that your Medicare was billed for that didn't happen to you or shouldn't have happened to you. And then what do you do about it? How do you report it and get it resolved? So we all were told, a long time ago, don't carry your Social Security card in your wallet. When I volunteered or I was considering volunteering to work in Senior Medicare Patrol, the volunteer coordinator came to my house to interview me. And I asked her, I said, well, what kind of things do you tell people in these talks? And she said, well, first we tell them not to carry their Medicare card in their wallet. And I'm thinking to myself, okay, I better take it out of my wallet, and when she leaves, where am I going to put it? And the reason that we say that is, you lose your wallet, you lose your purse. That Medicare number is worth a lot of money to some people. That's one way that they get numbers to make false charges to. So now I know you're all probably thinking, suppose I'm in a car accident and I get rushed to the hospital, will they take care of me? I can tell you from personal experience that you will be taken care of. 2 stories. I was giving blood in Natick at the library, and I don't know, I just was dizzy or whatever. They decided I was dehydrated. I needed to get an IV. They called an ambulance, took me to Leonard Morris Hospital. I didn't have my card with me because I was playing by the rules, and it's testing the system. And they take me in the ER, and I said, I don't have my Medicare card with me. They said, that's okay, we can look it up. And that was, when our Social Security numbers were on the Medicare cards. I think it was. Anyway, they said, no, we'll look it up. Just, give us your social security number. And that was the end of it. And then you're thinking, suppose I'm out of state. What's going to happen? I got a story for that one, too. We were in California, and my husband, I don't know, he stumbled or something, and he hurt his knee. So we go to the ER. And again, he says, because he did listen to me on this particular thing, and he didn't have his Medicare card. And they said, not a problem, we can look it up. And that was the end of it. And they were able to look up the MedX number as well. So don't be concerned. You will get taken care of if you don't have your Medicare card with you. Okay, so basically you only want to carry that Medicare card around when you're going maybe to a new doctor. And then when you go to the pharmacy, you have a drug card that you want to take with you. And I think you'll realize, like you go to CVS, you give them that drug plan number, and they have it on file. So you don't need to carry it around with you. All right, so that's the first big thing about protecting your healthcare information. Now, we all get a lot of phone calls. Probably, if you're like me, you don't answer them unless you recognize the phone number on the caller ID. You certainly do not want to give your Medicare number or your MedX number or whatever to someone that you don't know and trust. So I was going to a new physician, and the person, on the phone wanted my Medicare number, which wanted me to send a copy of my Medicare number by email. You're right. That's like putting it on a postcard to attach it to an email. I said, I'll verbally give it to you, but I'm not, and I'll bring the card when I come to the office. And they were willing to do that. So sometimes you have to push back a little bit on the system. The other thing I've had happen is I don't know if any of you had this happen in a doctor's office, they ask you for your social security number. My answer is, I don't give my social security number to anybody who's not going to give me money. So a doctor's office does not need your social security number. So, okay, so there have been other deceptive things besides these phone calls where they call up and they ask you if you have a pain. There have been postcards sent. I know my brother-in-law got one that said, call the pain center, we have a special back brace. I don't know if they're doing the postcards anymore. That was a while ago. And then sometimes some of these people, say, we're doing a survey. Right, not interested. So again, you don't want to give your Medicare number or your Social Security number to anyone that you don't know and trust. All right, so I mentioned that there have been some scams about braces, but there have been some other ones that have gone on that had to do with genetic testing. During COVID, there were people calling up and saying, I can get you on the priority list to get a COVID shot or get a COVID test. I mean, that has calmed down now. But I think that some of the genetic testing scams are still going on. And some of these people will show up at health fairs, like they do the health fair here. We haven't had any of them come here, but I've been told by other Senior Medicare Patrol volunteers that they will go to a health fair, and these clowns are there trying to sign you up to get a free genetic test. It's just, give me your Medicare number and you'll get a free test. Well, you want to be aware of that as well. Okay. All right, so we want to talk about how are you going to detect if something is amiss. This is something for you to think about. Do you keep track of your doctor visits, your medications, your medical history, record of your various healthcare plans? Okay, so one of the things we advocate is to keep track of all of this information. And one of the ways of doing it is we have this healthcare tracker. If this works for you, take a copy. That's great. I had someone come to a talk one day, and he said to me, I keep all the information in my phone. Hey, if that works, fine. But the idea is that you want to have a record so that when you get that Medicare summary notice, or if you're in a Medicare Advantage plan, you'll get an explanation of benefits. slightly different form. Yeah.
I have Brigham Women's, and they have patients. That is a real big plus today.
You're absolutely right. Yeah. Yeah. But the reason I'm saying, that if you can check your Medicare summary notice using the gateway, that's great. The whole idea is that you want to have a way that you can check, what happened. So that works. Someone once told me that they have a spreadsheet with all of it. Whatever works, you figure it out. But one of the things that I think is in this healthcare tracker is if you're going, a lot of times you go to the doctor and you say, oh, I want to make sure I ask X, Y, and Z. Well, I'll usually write it on a little piece of paper. But there is a place in here where you can write down those questions and the answers. Because, a lot of times you go to the doctor, you have these questions, you ask the question, and then, oh my God, I can't remember what he or she said. So you want to keep track of everything. This is just a sort of little aside. I said that we had some additional information. This is a list of questions that was developed by Consumer Reports for the Choosing Wisely campaign. And if you're going to have a procedure or a test, these are some things you might want to consider asking. Do I really need to have this? What are the risks? Is there some other safer, simpler option that I should try first? It's like if you go for some orthopedic problem, you probably don't want to rush right into getting a cortisone injection. You probably want to try going to PT first. So that would be, a simpler, safer option. What happens if I don't do anything? And this last one, I don't think it's a question for a doctor. How much does it cost and will my insurance pay for it? Yes, with Medicare, the physicians usually will know if something that they do is covered by Medicare, but they're not business people. So you may have to get the question answered, coverage answered through their billing people or maybe even calling Medicare. Okay, now, we talked about protecting our information. How are we going to detect if something is wrong? Again, we suggest having questions for appointments and keeping track of the physician's answers. Maybe taking this to a doctor visit if you feel it's a way that you can record what's happening. Then when you get any kind of a statement, like a Medicare summary notice, an explanation of benefits, you want to compare it to what actually happened to you. Or you could, as you said, you could go into the gateway and look and see if it's relevant. And if you have a complicated medical history, maybe you want to carry this or some record of your situation with you when you travel. And then finally, we recommend keeping the Medicare summary notices for 3 years, because at Senior Medicare Patrol, we've had a couple of cases where it had to be actually unwound several years, and the fact that the people had all the records made it a lot easier. Yeah.
So is that true even though all of this information?
I don't know how long Medicare makes the Medicare summary notices available online. I mean, you can get your Medicare summary notice electronically and then keep it. So that would be a way around the paper morass. Yeah. Okay, so I'm sure this is not an eye test. I'm sure everyone has seen this confusing form that we get from Medicare. Now the part that confuses most people, forget about what this is for, but there's an amount that the provider charged. That's what the doctor feels his or her service is worth. And then there's a Medicare approved amount, and Medicare will pay 80% of that. We're talking Part B. And then the maximum you may be billed is in the right-hand column there. And that's, if you have a Medigap policy, that's the 20% that the Medigap will pay. Okay, you and I were talking about that earlier. This is, yeah. Okay, yeah?
Is Medicare the same thing as your insurance company? Like I'm Red Cross, Blue Cross.
Okay. Are you in a Medicare Advantage plan where you have a copay?
Well, I stay away from doctors as much as I can. And I'm healthy.
Okay, but what kind of insurance do you have? You have
Blue Cross Blue Shield.
Okay, so you're in a Medicare Advantage plan.
I don't.
When you go to the doctor, do you have a copay in the office, $20 or?
Yeah.
All right, that's Medicare Advantage then. Okay, so your form will look different than this. All right, this is for those of us that are on basic Medicare. There's an explanation of benefits form.
Is this an insurance thing?
This is from Medicare.
Is that an insurance company?
Medicare is the government. A Medicare Advantage plan is run by a for-profit insurance company. So it sounds to me, if you're saying that your insurance company is Blue Cross, that you have a Medicare Advantage plan, and you would get a different form. Yeah. Tom, you said you were on you get an explanation. Yeah.
And the form isn't that different.
There is a copay on Part B if you're in basic Medicare, and depending upon the supplemental plan that you have, I think this year was $190, I don't remember. And if you have a core plan like I do, I pay that. If I had a more expensive Medigap policy, it might cover that. Does that make sense?
No, I'm just saying, there's a different advantage.
Yes, yes, you're absolutely right. Because if you have basic Medicare, you'll have a supplemental Medigap policy. But if you have Medicare Advantage, then that's one thing. Yeah.
So I'm a little confused when you say Medigap, because
But Blue Cross has a Medigap policy. It's called MedX. Is that what you're talking about? Or you're talking about the Blue Cross PPO or?
I'm not sure, when people say Medigap, are they talking $10 a month for?
Yes, okay.
So that's Medigap.
Yes, yeah. I mean, MedX is the Blue Cross product, but there are other ones, you know. Yes?
My Blue Cross card says medics on it.
No, if you don't have a copay. Yeah. It's supplement. When you go to the doctor, when you go to a new doctor, you show that card that has a blue stripe and a red stripe.
Yeah, that's my Medicare.
Okay, then you have a supplemental plan. Yeah. That's right. Part C is the Medicare Advantage. I don't want to go down too much of a rat hole on this because I have some other information that I want to go over. Okay, and then the last page of that Medicare summary notice is reminding you that you have 120 days from the date you got that Medicare summary notice if you want to contest anything in it. So that's important to keep in mind. Okay, we already mentioned that the Advantage plans use an explanation of benefits. So if you have any of these plans, I think a lot of people around here probably have Tufts. Okay, now suppose you found something in that Medicare summary notice that you don't think happened to you. What are you going to do about it? So the first thing we recommend is to call the provider. And usually you can, a good deal of the time you can get it resolved. I had seen my doctor for something and I had a follow-up visit. Medicare paid for the first visit but not the second one. And I said, I bet they didn't put the right code in. And I called up, I spoke to the billing person and she checked, she said, you're absolutely right. So that was the end of that problem. I didn't have to go any further. One of the volunteers at Senior Medicare Patrol had some kind of issue, a billing issue, something that Medicare didn't pay for. So she called, I don't know if it was a doctor's office or a hospital, and the person says to her, oh dear, you don't have to worry about that. And she said, yes, I do. I'm very concerned about Medicare fraud. All of a sudden, some supervisor gets on the phone, and the whole thing gets resolved. So The moral of that story is that sometimes you have to use the F word, fraud. Okay? All right, so let's say you strike out with the provider. You can call Medicare, and sometimes you have success, sometimes you don't. Then, if you're totally frustrated, or even if you're not totally frustrated and you're just uncomfortable dealing with this whole process, you can call Senior Medicare Patrol. And as I said, we have caseworkers that will help you get the problem resolved. We had, one case, a woman was going into Cape Cod Hospital for some kind of a back procedure, and they told her it was going to be a day surgery. Now, one of the things you have to understand about day surgery, it's covered by Part B of your Medicare. People on Medicare Advantage, this doesn't apply to you, so you can tune out, all right? So if you have an outpatient surgery, it's covered by Part B, which means that Medicare will pick up the 20%. If you were admitted to the hospital, then potentially, depending upon the type of supplemental insurance that you have, you may be hit with a big deductible. I don't know what it is this year, $1,400, I don't know, $1,700. So this woman had the basic supplemental plan that did not cover that hospital deductible on the Part A. And she said to the doctor's office, I need to make sure that this is going to be a day surgery. And they assured her it was day surgery. The hospital told her it was day surgery. She goes in, has the procedure, goes home, and lo and behold, she gets a bill for this Part A deductible. She was never admitted to the hospital, okay? And she came to Senior Medicare Patrol about it. Well, Senior Medicare Patrol investigated it, and it turned out she was not the only person at Cape Cod Hospital that this had happened to. And eventually, Cape Cod Hospital had to rebate all that money to people that they had obviously overcharged. Plus, they get a higher fee by having you listed as an inpatient because they charge you like you were in a room. So that's something to be aware of. Okay, what else? I have one other story. This is a personal story in my family about speaking up, not being afraid to talk to the provider. My parents moved to Florida in the early 1970s. Now, remember, Medicare started in 1965. So my father has a terrible stomach ache. He goes to the ER, and he figures they're going to give him something for an upset stomach. And they said, Mr. Birkin, you have appendicitis, and we need to operate right away so your appendix doesn't burst. By the way, having appendicitis is not an old person's disease. It's usually a younger person's. I don't know how many of these Medicare will pay for. But anyway, so my father's in the ER, and the surgeon comes in, and he said, we're going to take you to surgery right away. And my father says to the doctor, I need to know how much this is going to cost. My father was not like this. I don't know where this came from. But anyway, the doctor says, don't worry about it. And my father says, no, I want to make sure that I have the money to pay you. Because at that time, in the state of Florida, the physicians were allowed to balance bill. Balance billing is paying the difference between what the doctor thinks he's worth and what Medicare allows, okay? So he tells my father a number. Fine. He has a surgery, and lo and behold, he gets a bill from the doctor's office that was higher than what the doctor had quoted him. So he calls and speaks to the billing person, and she gives him a big argument, and no, that he didn't know what he was talking about. This is, what we charge. So my father goes back for his follow-up visit, and he says to the doctor, I have one problem, and he tells him the story. And he said, I tried to, he says, remember in the emergency room when I asked you how much it was going to cost? And the doctor said, how could I not remember? You're the only person who ever asked me that. So he says, the doctor says, don't worry, I'll take care of it. And he goes out, and my father hears him in the office chewing out his billing manager. And he comes back and he says, you pay what I told you. So I think the moral of that story is, if you ask in a nice way, you can question things. Okay, so there are some ways you can report problems. Every state is required to have a quality improvement organization for Medicare. And in Massachusetts right now, it's Essentra Health. Okay? Now, if you are in the hospital and they're saying, okay, we're going to discharge you tomorrow, and you think that there's no way I can go home, I just really am not feeling well, you can contact Essentra Health, and that will buy you at least one more day in the hospital, guaranteed. Now, I will tell you, we had someone from the recent, not these people, but the prior QIO from Massachusetts come and talk to us, and he said about 85% of the time, they will agree with the hospital's decision. Regardless, you're going to get another 24 hours in the hospital. I had somebody come to a talk that I gave in Carlisle recently, and she told me a story about her father-in-law was about to be discharged, and the social worker told her to call these people, and she said, that was it. We got another day, and it allows us enough time to get the house set up for him to come home. So, good question. I am not sure. I would suspect it is, but I'm going to try and find out. That's a very good question. I don't know. Okay, and similarly, if you're going to be discharged from a rehab facility and you felt you weren't ready, you could also call these people. And if you had any kind of quality of care complaint, you can contact these people, okay? I had someone come to a talk one day and tell me, I think I was shortchanged and not treated very well in the emergency room because of my age. That's something that you could report to these people. Okay, now, why don't people report? It's what I said before. One of the reasons is it's not coming out of my pocketbook. My supplemental is going to pick up the extra. I'm not going to worry about it. Wrong answer. You figure, I don't want to bother my doctor about this. You're not bothering your doctor. You're calling the person who handles the billing. Some people find that Medicare summary notice or an explanation of benefits form confusing, and they're not sure what questions to ask. Senior Medicare Patrol can help you with that, and the Shine counselors can also help you with it. Does everyone know about Shine and that we have 2 Shine counselors here that you can contact? Okay. You probably have had contact with them at open season? No?
Our technical experts. She checked it out. It does cover it.
Okay, good. Thank you. All right, and then there are some minority communities that are just uncomfortable with this whole process. I gave a talk one day, I think it was a Haitian community in Boston, and I had to have a translator with me. So sometimes, people have a language issue, and I don't think that's an issue here. And finally, the all-time favorite is, I think I'm the only person having this problem. I don't want to call attention to myself. So let's get rid of that one too. You don't need that. So if you experience a scam like the genetic testing or the braces, you can contact the Attorney General's office. They have an elder hotline, or you can call Senior Medicare Patrol. I think a lot of these phone numbers are in the back of this. Yeah. Okay. So if something doesn't feel or sound right, it probably isn't. Trust your instincts. You can call Senior Medicare Patrol, and we will help you work through it. And finally, you don't want to pay any bills until you've compared them to, what you have a record of, the Medicare summary notices or explanations of benefits. Because if you pay something and then there was a mistake, good luck trying to get the money back. So let me leave you with these final messages. I think if you go away with any of these, I've been successful. First, you don't want to carry your Medicare card around. And we actually have, where is it? We have some of these little sleeves that are designed to put your Medicare card in. I don't know if a Medicare Advantage card will fit in here. But you can put your Medicare card in here and your Your MedX card will fit in here. There's a bunch of them on the table there. And figure out some place in your house where you can put your Medicare card where you'll remember where it is. I have it in the top drawer in my desk, right in front in that little pencil tray. Okay, you do not,
Okay, carry my medics card with me, you know what?
I don't carry mine around. I mean, you know, it really doesn't do someone any good without knowing your Medicare number. So, yeah, I don't carry either one of them around with me. All right, and then you do not want to give your Medicare number over the phone to anyone you don't know or trust. And I would say even in person, if you meet one of these characters at a health fair. You want to keep a record of all your medical events so that you can compare it when you get any kind of a bill or the Medicare summary notice. And you want to review those Medicare summary notices and explanation of benefits and any billing statements that you might get. And you want to make sure that they're accurate. And then finally, if something doesn't look right, you want to take action. If you suspect that there's an error, there's fraud, there's some kind of abuse, you can contact the Senior Medicare Patrol program and we will help you work through it. So, finally, I want Medicare to be here for us. I want it to be here for my son. We all hold the key to preventing healthcare errors, fraud, and abuse by becoming fully engaged healthcare consumers and encouraging the people that we know to do the same. I know that if any of you bought a television at Best Buy and you came home and plugged it in and it didn't work, you would be back in Best Buy in a heartbeat. And we have to think of our healthcare in the same way. So I hope that some of this information that I've given you will help you do that. You're welcome.